Jimmy did a training for us a couple of weeks ago on just the intro to LGBTQ. Did I say that right?
Yes, ma'am.
Okay, and it was really great, and we really enjoyed that presentation. And so I asked him to come back and talk to us a little bit more, to go into a little more depth about the subject. So everybody will get a certificate, and also I will submit all of your names to central office for your cultural diversity training credit hours. So.
Thank you, Chris.
Okay. Yes, absolutely. So I'm going to put my video on mute just because I have my dogs out. So Jimmy, I'm going to let you take over.
Great. We are recording the webinar today, and I've already started that recording. So just be aware of that. So watch your mouth, no dirty words. So thank you again for being here. My name is Jimmy Whittyfield Jr. I'm a licensed professional counselor and currently work as a program manager at the Oklahoma Commission on Children and Youth. OCCY is a state agency that is involved in addressing child maltreatment in the state of Oklahoma through a variety of programs. I oversee a program for freestanding multidisciplinary teams. These are teams of professionals that investigate and prosecute child abuse allegations. There are 37 teams, freestanding teams in Oklahoma. These are teams that are not associated with the Children's Advocacy Center. CACs, of which there are 20 in Oklahoma, are required to have an MDT for accreditation purposes. So the freestanding teams operate independently. Part of what we do is provide training on issues relevant to child abuse and neglect. And while today's webinar and the part 1 webinar is not a part of that, it certainly is relevant. And so I'm excited to bring this information to you. Quickly about using the Zoom platform, I'm sure you were all very familiar with this, but there is a chat function. I hope and encourage you to use it. Also in the participant list or in your Zoom window, you can find the microphone icon where you can mute and unmute yourself. Everyone is currently muted, and I appreciate that. It helps reduce background noise. Please don't start your video unless you want to speak, just because as videos start on Zoom, it can shift around in the screen view and can be distracting. And the more people that join by video, the higher the risk of there being quality issues. So just something to keep in mind. So when I did part 1 of this presentation a couple weeks ago, it was The More You Know, LGBTQ plus youth and their families. I shared a little bit about myself. I am 46 years old. I have to always think about it. I'll be 47 this year. And I came out of the closet as a gay male in 1991, a month after I graduated high school. In high school, I had one girlfriend, and in full disclosure, I even had sex with a girl. And after graduation, and meeting really kind of the first people I ever knew to be gay, and became friends with, and then connected with another person who eventually became my first boyfriend that summer, it was really a moment of just an awakening. And since then, I have really been interested in LGBTQ plus issues, not because I'm gay necessarily, but more because I really embrace diversity. I have strong interest in diversity of religion and spiritual beliefs. I'm also not part of a religious majority, certainly in Oklahoma, but definitely not in the United States. And I think there's a lot to be said with taking our experiences or our understandings, kind of when we realize that there's a lot we don't know that we don't know, and using that to propel my professional work and my personal mission to just be a better person and to provide better services to people. So that's kind of my background coming into this and what drives me to do this work. For the PowerPoint today, there are pictures. I have shamelessly taken them from the internet. And I will share that the majority of my slides today are just pictures, no text. Part one of this webinar was very content focused. There was a lot of information to cover. What does LGBTQ AAAIF2SPD stand for? What does SOGI stand for? What are the stats on queer youth and foster care, juvenile justice, outcomes, etc.? I'll do a brief review of that today, but really the use of pictures throughout today is to help just challenge your perspective, challenge what you're seeing, and get you to think just in a different way. So these are not pictures I have permission to use. Clearly, if I'm using something that an owner may not want me to use, I am okay with that. And if that is anyone on this webinar, then just please let me know. The other important thing for us to keep in mind as we move forward is that you have to take care of yourself. So today, if you hear something that impacts you in an adverse way, something that brings up maybe memories, reminds you of your own experiences, past or current, but you're feeling bothered by that, whatever it may be. I want you to take time to care for yourself. Remember the coping skills that you may be working with clients on, and apply them to you. Hopefully you are all trauma informed. There's a lot that we can take from being trauma informed professionals to make sure that we are operating in a healthy way. So take a moment. If you need to reach out to someone, if you need to tune out of this webinar just for a little bit, if you need to stand up and stretch, but I want you to be healthy and I want you to be okay, because you can't help other people unless you are healthy and okay yourself. So with that said, let's get into a little bit of review. When we met in part one, we talked about LGBTQ+, lesbian, gay, bisexual, transgender, questioning, and then there's a whole bunch of other letters that go after that. And the plus is meant to represent the entire kind of initialism, which includes queer, asexual, agender, affirming, ally, friendly, demisexual, pansexual, intersex, two-spirit. The list goes on and on and on. And generally, the LGBTQ plus initialism doesn't adequately address gender non-binary, gender fluid, gender non-conforming, gender variant, gender neutral, the whole range of gender and expression and identity. So the term that is now coming into favor is SOGIE, S-O-G-I-E. And SOGIE stands for sexual orientation, sexual identity, and gender expression. And it's meant to be really an inclusive term that really anyone can fit into. And so when we talk about SOGI youth or youth who are SOGI, we're generally talking about children and adolescents or people who are not a part of the sexual majority. These are people who are something other than heterosexual and or cisgender. Cisgender, C-I-S, gender, is a term used to describe people that their internal sexual identity matches the sex assigned to them at birth based on their physiological or physical appearance, their genitals. So I identify as a cisgender or just simply cis male. When I was born, the doctor looked between my legs, saw that I had a penis and scrotum with testicles, identified me as male and a boy, and I identify that way today. People who are transgender, the doctor, if I were trans, the doctor may have made the same determination at birth, assigned me the sex male. And then as I get older, I realize that I don't identify as male, that really I'm female. And so I could identify then as transgender. So SOGI, again, sexual orientation, gender identity and expression. So SOGIE is meant to really be a larger umbrella term. There is some conversation in the LGBTQ plus communities that the initialism or the acronym is really getting too big. And everyone is getting their own letter in the alphabet. And personally, and this is just Jimmy personally, I think that gets confusing. I think we start losing our identity if we start to get so specialized. But on the other hand, I can really understand why people want that initialism, because LGBTQ plus people have been marginalized, have been victimized throughout human history. And it's part of an identity to belong to something, a group that accepts who you are. So in terms of terminology, I think where we're going to do a little review is here on the gender unicorn. The gender unicorn gets at several important concepts. And we're going to start with sex assigned at birth. And so you can kind of see the DNA spiral, male, female, other, or intersex. The sex assigned at birth is generally assigned based on the physical presentation of your genitals. You have a vulva, you're female. You have a penis and scrotum with testicles, you're male. There are people who are considered intersex. That's a term that replaced hermaphrodite, people who are born with ambiguous genitalia. However, intersex is so much more than just ambiguous genitalia. And these are people that may be born with parts of male and female external genitalia. People who are intersex belong to a larger group, a medical group of disorders of sex development. There are many types of DSDs that could impact the sex assigned at birth. And so doctors are really making great strides, or medical professionals in this area, and trying to make decisions at birth that don't have significant long-term implications for children in adverse ways. So when someone refers to I'm a man, I'm a woman, they're generally basing that off of the sex assigned at birth. Now, from that, we get into gender or sex identity. And you can see that's kind of the rainbow and the thought bubble at the top of the gender unicorn. Your sexual and gender identity come from your brain. And this is how you identify. I identify as male, man. And so my sexual identity is that. If I, at birth again, was assigned a male sex, but in adolescence or childhood or adulthood, my sexual identity forms and I think I am a woman, I am female. That is my identity. Gender identity is similar. So the terms sexual identity and gender identity can be interchangeable. Gender, though, most people would argue comes more into gender expression. And this is how we present ourselves to other people, right? Our outward appearance. And in the gender unicorn, you can see it's the green kind of dotted line that encompasses all of the figure. So I identify as a cisgender male, and I dress, my gender expression is masculine. And so you'd see me wearing blue jeans. I'm wearing a short sleeve pullover shirt. I've got kind of a masculine haircut, or what would be considered masculine. I keep my nails trimmed. I have a goatee and a beard. Um, those are stereotypical expressions of men. And so generally we assign feminine and masculine to gender expression, but there can be other, right? And so we're really seeing this now in kind of what's commonly referred to as being genderqueer or gender benders. Though gender bender is a little bit of a dated term now. Young people typically who are exploring their gender expression. And so how you present yourself. Now, this is all very different than physical and emotional attraction or sexual orientation. And I just want to say really quick, I see a couple of comments in the chat box, and I promise I'll get to you in just a moment. We grow up as typically in child development, right, human development, when we're very young, we tend to be heterosocial generally at first. So very young children play with uh, other children identified as boys and girls. They just play with whoever will play with them. As children get a little bit older, they become very homosocial, right? Again, identified boys tend to play with identified boys. Girls tend to play with girls. And then it's not really until probably adolescence that we start to see a little bit more of that mix where children are mixing between boys and girls. And so in our friendships, in the relationships that we have, we form really strong emotional attachments. Think of your best friend, maybe someone of the same sex, maybe not, but you have a strong emotional connection. Physical attraction starts to play more into sexual orientation. The sex that I am oriented to romantically, sexually. So I'm a gay male. I am sexually attracted to other men. I'm generally attracted to masculine gender expression. And so that's my orientation. The term used to be sexual preference, right? Oh, Jimmy, what's your sexual preference? And I would tell you that my sexual preference is about 5'8", about my build, and someone with a good sense of humor. I like nerdy and geeky. Those are my sexual preferences, right? My sexual preference isn't men. That's my sexual orientation. So the gender unicorn helps us kind of see these different constructs in different ways. So I'm going to go to the chat box really quick. Chris Jarko was wondering, how many different ways can one identify? That is an excellent question, and it's going to be a good segue into the next slide. And the way that we can identify ourselves really has, right now, probably infinite ways. It used to be that you were man, boy, boy, girl. That was that. People didn't talk about trans people. It was really recognized, or gender fluid people. And so people just generally knew that there was cisgender. You were either cis, which again, your sexual identity matched your sex assigned at birth, or you were just different, right? Generally, you'd be called queer, or you might have been called a cross-dresser, right? Which are derogatory, or cross-dresser, clearly derogatory term, though there is transvestitism, which is can be a paraphilia. Queer used to be derogatory, and now queer has come back and is being accepted, and describes people who are just different, who don't really ascribe to any one category or few categories, diverse. Trans people, as we talked about, identify their sexual identity as something different than what they were assigned at birth. There is an ongoing conversation uh, that sexual identity is also on a spectrum, that there can be male, female, there can be trans, there can be other. It really, people are pushing the boundaries here, and it's young people who are pushing those boundaries and forcing us to rethink these constructs. Gender fluid is a term that we hear. These are people that, again, as it describes, tend to be more fluid in their sexual expression or identity. Um, I can think of support groups that I've gone to through PFLAG, and seeing participants in that group that were wearing, seem to be male, were wearing some female clothing or female shoes or nail polish. I see that much more in young people these days. And as older people feel more secure and safe to be who they are, to live their authentic lives, we start to see that more there. Gender can also be agender or asexual. Agender is not, it's kind of being androgynous or people that don't really feel like they fit with a gender. Asexual are people that have no sexual attraction to other people. They have no interest in sexual attraction. They don't ascribe to a sexual orientation. And another term you'll hear is non-binary. Binary, when it comes to gender, is male, female. You have two options, 0 or 1, right? That's binary. Non-binary people don't ascribe to that construct. So, I think some good examples, I've said the word construct now several times. Gender is a human construct. Sexual orientation has been documented, well documented in Greek history. The Romans, most cultures in the world have documentation of sexual orientation of something other than heterosexual. But when you really start to look, you also find documentation that gender has also been not binary in many, many cultures. I think in part one, I mentioned there are third genders, or what are considered third genders, in Afghanistan and Pakistan, India, I think it's American Samoa or Guam, all through the world. And some American Indian tribes have a distinguished two-spirit category for people who ascribe to a non-binary or something other than heterosexual. So remember, cisgender is your sexual identity matches what your sex assigned at birth. It doesn't mean anything about your gender expression. And this is where things, I think, can get a little wonky. For a lot of people, that this may be new information. So I'm going to use some pictures to help describe it. I think you're all familiar with the Rubik's Cube. Came out in the 80s, wildly popular. I love Rubik's Cubes as an analogy for lots of different things. So if you're cisgender, you're pretty much probably like a Rubik's Cube in terms of you go with all of the colors that you've been assigned, right? So again, I was assigned male sex at birth. I identify as male, and my gender expression is masculine. It also just happens that my sexual orientation is homosexual or gay. And so my sexual orientation has nothing to do with my sex assigned at birth. It has nothing to do with my gender expression. It is its own separate thing, but it makes up part of who I am. People then start to get to express their individuality. And in a Rubik's Cube, when colors are when you don't have solid colors on one side or any side, then we really start to understand, I think, better sexual identity, gender expression, even sexual orientation. So there's a binary construct that you're either gay or straight. We could put bisexual in the middle of that. But now there's pansexual, people who are attracted to people regardless of their sexual identity, sex assigned at birth, and gender expression. Miley Cyrus Janelle Monáe to very popular recording artists, identify as pansexual. It's not that they're going to sleep with anybody and everybody. They're attracted to just people, right? And if that person is a cisgender female with a masculine gender expression, they might be attracted to that person. They might be attracted to a trans person, um, uh, a feminine man. To them, they're falling in love and sexually attracted to the person, who they are. There's demisexual. Demisexual are people who identify with the demisexual orientation, are attracted or form feelings of attraction when they have an emotional connection to someone. And so that, again, is a little bit regardless of sexual identity, gender expression, etc. They have that connection, an emotional connection to the person. So the Rubik's Cube that's multicolored is just how we express ourselves. I worked with an 11 or 12-year-old boy who identified as bisexual, but was also, he did not use this term, but something like gender fluid. And so when he showed up to group therapy, mind you, and this, I led for 17 years a group for children ages 10 to 14 that had engaged in problematic or illegal sexual behavior. And he had engaged in some problematic sexual behavior. But he showed up and his nails were painted. Sometimes he had eye makeup on. Sometimes he looked more emo than anything. And it was so beautiful to see, because here was a child just exploring their identity, exploring what it meant to express their identity, and to really just kind of sort through who they were authentically. I think it's important to note that not one other child in that group, and there was generally 6 to 8 children in this group, not one of them batted an eyelash at this boy in his expression or his bisexuality. And so it was really telling, because 15 years ago, 10 years ago, like, the other kids would have been raising an eyebrow. So things are changing. So the way that we express gender, our sexual identity, our sexual orientation, just depends on the individual. Just when you think you can understand a Rubik's Cube is square with 6 sides, it's a cube, something's going to happen. And suddenly it's going to be a Rubik's pyramid or some other type of polygon, right? You're going to be thrown off. You're not going to know what to say, what to ask. And that's okay. I think us as professionals, if we can just remember that we are learners, and when it comes to diversity, we're not going to know everything, particularly if it's not our world. I live every day as a gay man. Most of you do not. And so if I'm talking about RuPaul's Drag Race, or I'm talking about spilling tea, or how I like to refer to my husband as my partner, because I grew up never thinking I'd have a husband because it wasn't legal. You know, all of those things, you won't have that understanding. And so it's okay to not have that understanding. I don't have the understanding of what it's like to be a female. I don't have the understanding of what it's like to be African American or Muslim. And if you can recognize that there's just things you don't know. But if you can be open, right? Ask people to help explain things, to be patient with you, and you make an effort to be different, then you're providing better services. So the next good handful of slides are just pictures. And I'm going to challenge you in some ways. And then I promise we'll get to the Q&A, which will be the bulk of what we talk about today. When it comes to children, um, it wasn't until I think maybe the 1940s that there was a shift of really kind of assigning colors to children. Um, it used to be that regardless if you were assigned male or female at birth, you were typically dressed in a white gown. Your hair wasn't cut until you were about 6 or 7. Um, and there was this kind of almost feminine look to all young children. Um, Usually girls were dressed in blue because it was seen as a passive color, and boys were dressed in pink or red because it was seen as a color of strength. It wasn't until about after the 1940s that we started to see a shift. Girls went to pink, boys went to blue. Um, and then they started not keeping children in dressing gowns until uh, early childhood, out of infancy and being a toddler. And so really started changing. We look at a child that's dressed in blue overalls with, a teddy bear holding a baseball bat, you're going to think boy. You see a little girl, she's typical, or you see a child that looks like a little girl that's dressed in lace or frills, um, dressed with flowers or butterflies, we automatically think girl. In this picture, I think most of you are probably clearly looking at a girl with long hair and a boy with short hair wearing a chain necklace. Pretty straightforward. This is how our brain works. We as humans find meaning and we categorize people into our existing framework of how we make sense of the world. We're actually looking at a trans couple. The girl with the long hair was assigned male at birth, and the boy with the short hair and the necklace was assigned female at birth. This is has been a very well-known couple. They were actually dating for a while. They're no longer together. But this picture really challenges us on what we're seeing and not to make assumptions. Children express themselves in lots of different ways. And the pictures that you'll see from here on out are not what they seem. This child, long hair, playing with a doll, dressed kind of in a girly or feminine top, was born at birth, was assigned male sex. There's a famous photographer, Susan Chong, who did this beautiful photo shoot of trans children. And so it really challenges what we think. And what I hope you get from seeing these pictures is that you're looking at children. Put boy and girl to the side, right? And if we can do that and you see children and our job is to help children, then you're really at the right place. Children engage in gender behaviors based on the social cues coming from around them. Boys play with trucks, girls play with dolls. You see a boy start to play with a doll, no, 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 only girls play with dolls. Children learn gender roles and gender expression from the grown-ups in the world around them. Some children, though, don't agree with that, and they're going to let you know. Some children want to live their authentic self. So if you're assigned male at birth, but at 9 or 10, no, I'm really a girl. Children are going to want to live, again, authentically, live who they are. Remember, in child development, children learn gender early in life, usually by about the age 3 or 4. They have a pretty good sense of boy versus girl because that's what they are told and taught. As children get older, they learn roles, that they're going to question things. Just like sexual orientation typically solidifies in adolescence, but some children know early on that they may be something other than heterosexual, or they may be trans, or they may be gender non-binary. Some people don't realize that until they're older. Some people may not realize that until they're an adult. But more and more, what we're seeing happen in the world, particularly the United States, is that young people are identifying their true selves much earlier in life. and the world is a safer place to do that. I struggled as an adolescent with my sexual orientation. I was very confused, and that caused a lot of problems for me. I had depression. I was at times had suicidal ideation. I was bullied at school, often called fag. And the whole time I'm like, no, I'm not. No, I'm not. But I was struggling internally because I was sexually attracted to other guys while trying to have a girlfriend, trying to sort that out. The world for me then was not a safe place to come out. Um, there was one other boy in my high school that people assumed was gay. It turned out he was gay. I learned that much later. He was bullied constantly, constantly. We both faced physical violence. We were both shunned. You know, it was always you're being prissy, etc. And so it wasn't safe from, I didn't feel safe to come out. But clearly here's a youth that feels safe at graduation, right? To express who they are, to live who they are. And again, if we see this as, here's an adolescent, right? Here is a child that needs our help. Again, just kind of some more pictures of children that, you know, as young children versus adolescents, and what living is like for them when they get to be who they are. There is some conversations about, you know, people get curious once they find out that you're maybe a trans person. Well, what did you look like as a boy? What was your boy name? Those questions are really not appropriate because the person who is trans is living, again, their authentic life, who they are, their authentic identity. It's natural for people to be curious. Um, But you need to be sensitive. If there's a part of someone's life that they're so vastly different, asking them, well, gosh, what was your boy name? Has no relevance because they're now going by the name that they want to be called by. They are now using the pronouns they want you to use. They are now going by the sexual identity they want you to use for them. And that's where just remembering we're humans. If this is new to you, it's new to you. But remember, we have to find ways of being respectful. You know, I'm just amazed at the bravery that these children have um, to be able to express themselves and to be part of something that's so much bigger than who they are as individuals, but being able to do it in a way that promotes other people to really just live who they are. There are a number of famous celebrities that have children who are trans. Um, so here's Warren Beatty and Annette Bening. Their child is trans. Probably most famously, Cher's child, Chaz, is trans. Um, and Angelina Jolie and Brad Pitt, one of their adopted children, has not come out as trans, but certainly has a gender expression that is not what you would expect, right, stereotypically for a little girl. And they have been very affirming in allowing their child to explore who they are, express who they are. What I love about these pictures is that I see children. I don't see children who are trans or children who are non-binary. I just see kids. And personally, I just can't help but want to help them if they need help. Not help changing who they are, but help with whatever it is they're facing, their stresses, their issues. Remember, I mentioned people can be agender or not ascribe or androgynous, right? This is a very famous model who is androgynous and is actively sought out because of their beauty. Children just are who they are. And when we can engage in affirming practices, right, of helping children explore who they are in safe ways and express who they are in safe ways and surrounding them with supportive people who love them, then all the better. Um, and so I'm sure I sound like a PSA, right? Um, but what I hope you take out of this is that our job is to help children be healthy and happy. And often that means working with caregivers who may be struggling with their child's sexual orientation, sexual identity, gender expression, etc. We may be struggling with that. But if our goal is to help children be healthy and happy, then we're going the right way, regardless of who they are. So I've mentioned several times terms like living your authentic self. That is something that you'll hear when talking about SOGI youth and people. So when we can really live who we know we are, and we can do that in a way that makes us feel safe and comfortable and allows us to express ourselves completely without having to hide who we are. Um, you've also heard me talk about being affirmative or affirmative treatment, affirmative practices. We talked about this some in part one. Um, this is, again, keeping that focus on uh, our job is to help people be healthy and happy. And how do we do that? We have diverse literature in our agencies. You might have a small rainbow flag or rainbow sticker that identifies you as an ally or someone who is safe to talk to, someone who um, works with all kinds of children and people. Um, uh, taking or providing affirmative services means addressing when there's a type of phobia, be it transphobia, homophobia, heteronormative language, right? Um, you know, think very much if you provide services, and this is going to be a gross simplification, but if you're providing services to African Americans or people who are Latino, hopefully your agency has materials in English and Spanish, or materials that have graphics of people who are white, black, brown, whatever, right? Whatever the ethnic identity is, regardless, right? If you're, in this situation, if you're affirming, if someone starts to tell a joke, right? A white guy, black guy, and a Latino walk into the bar, you're stopping them immediately and reminding them that's not appropriate, right? We're not here to joke about someone's identity or ethnicity. It's the same with people who are in this SOGI group, right? Um, so that's what it means to be affirming, and that plays into being an ally too, right? Someone who is actively working to support these youth. So I've done quite a bit of talking. I know that there are a couple of questions that Chris has mentioned to me that I'd like to address when it comes to providing services. And if you are so inclined to use the chat box to ask questions or to unmute yourself, by all means, go ahead. And I'll give you a few minutes or a couple minutes if you have a question right now. Well, it's a little quiet. So I'll launch into a couple of the items that Chris had mentioned to me. I think what comes to mind for a lot of professionals um, is you are referred a family and the child identifies maybe as gay, and the parents are uh, not accepting. They are they don't want their child to be gay. And how do you manage that? Um, Chris, I see you're on video. Does that sound about right with one of the issues that we discussed?
Absolutely. So just if you have a family that comes in and their child is wanting to dress the opposite way than what they were born with, how do you address that with families?
That's a great question. So um, I'm going to take a two-part approach. We're all professionals, and hopefully we have the education and the training that helps us identify a basic framework when there is uh, two differing points of view, right? A child who is dressing um, as a gender other than what their parents assigned to them, and then the parents who disagree with their child's behavior. Um, so, just generally, how do we approach when parents disagree with their children, or disagree with anybody? So remember, you have a lot of the skills already. It's just working on how does that fit here. So, I think the approach that I have taken before, and in full disclosure, this is not my life's work, working with SOGI youth. Um, I have addressed it with families. Um, and so understanding child or human development, right? So think about the age of the child, um, what their environment is, and reminding parents that children explore. Children explore how they dress, how they act. Um, uh, it doesn't mean that it doesn't mean anything about who they're going to be as they grow older. So it is impossible to predict if a child is going to be trans or cisgender. It's impossible to predict if a child's going to be gay, bisexual, heterosexual, or something different. It's impossible to predict if your child is going to wear fingernail polish, if your child's going to be Democrat or Republican, if your child's going to be Christian, Jewish, Wiccan, anything. What we do in childhood is part of our development. And when you look at the research on gender development or sexual orientation, you'll find mixed results. You'll find that some children know early in life that they're different than the majority, some adolescents, some later in life. Having this type of psychoeducation available to talk to families, to talk to parents, is going to be really key, giving them some understanding. So we'll be exploring with them, what are their concerns? How might their reaction to their child have an adverse impact on their child's well-being in the short and long term? So if a little boy comes in and insists on dressing like a little girl, right, and we're going off of stereotypes here, um, so wants to wear a dress, wants to paint his nails or his toenails or both, and the parent is unhappy, um, exploring why, exploring with the child. Gosh, tell me a little bit about how you made decisions on how to dress today, right? Uh, it really is taking a curious approach. Our job is not to, I'm not going to say this the right way, I don't think. Our job is not to change someone's mind. Our job is to help people think differently so they can make sure, again, that their children are healthy and happy. So if a child is dressing different than what their parents want or believe they should dress, how do we come together, right? To help them have a healthy response to their children. Often this comes up around sexual orientation. I don't want my child to be gay. I need you to fix him or her. That doesn't work. And so in some of the more extreme cases where parents have just dead set against it, or maybe dead set against their child being trans, right, or gender fluid, try to understand their perspective, get them to flesh it out. It could be driven by religious beliefs, um, cultural beliefs, but ultimately, I believe, and I've been successful in doing this, if we can bring parents back to they love their child, then you got a place where you can start from to move forward. If parents are engaging in practices that you suspect could be abusive, psychologically abusive, emotionally abusive, certainly physically or sexually abusive or neglectful, you're required to report that to the Department of Human Services Child Abuse Hotline. So keep that in mind. Some parents will take a really mean approach. They kick their child out of their house. They refuse to let their child wear the clothes that they want. That's one thing. But when it starts to create psychological distress, that's something different. And that's where we come in to help them problem solve. Um, so there isn't really a straightforward answer other than provide psychoeducation, try to understand everyone's perspective, where they're coming from. And if you can get people to get back to this primary goal, you love your child, you want your child to be happy and healthy. Where do we go from here? How do we move forward? So that really, I think, is a standard framework that we see in the literature um, on helping SOGI youth. It's not easy work. Uh, families may not come back to you. Families may vehemently disagree with you. But if our job, again, is to help people be healthy and happy, then that's where we start. I'm seeing in the chat box a couple of items really quick. How would you address a family who pushes a child one way or another? Let me scroll back up. A male who is encouraged by a parent to be feminine or vice versa. It's a really interesting question. Parents, of course, I believe parents are doing their very best with what they have. And so when parents are insisting that their child be one way or another, they're operating from a belief system. And again, it's our job to try to understand their perspective. I have friends who are same-sex couples that have children either through adoption or surrogacy, who very much don't want, I remember one when his child was young, walking into the daycare and his son was in a cheerleader's outfit and really wanted to dress up wearing the skirt and have fun. And he was dead set against it, absolutely. And the conversation was, Jimmy, I know I should be more open. I'm gay. I know people who are trans, but this is not my kid. I'm not going to have this for my kid. With a little, and not being his therapist in any way, but with a little conversation, trying to understand what's going on, right? There was concern. I don't want my child to be bullied. I don't want my child to be harassed. Some parents may insist that their child dress or be a certain way. So in the question that Lori was asking, for example, a male who is encouraged by a parent to be feminine or vice versa, sometimes parents think that they just know who their child is and they're trying to encourage them to be the authentic self the parent thinks that they are. I've seen this probably more in parents who believe that their child is gay and then are suddenly flooding them with, gay media, or suddenly they're going to the gay pride parade, or et cetera, because they want so bad for their child to be their authentic selves, and they've not really asked their child, or they're not giving their child the space to explore on their own, right, in safe and healthy ways. So when a family is insistent that a child be one way or another, again, understanding that perspective, helping them to find constructive ways to explore with their child and to understand their child. And helping them understand that if you force someone to be someone they're not, right, what are the potential adverse outcomes, right? We see this in depression, anxiety, that can lead to drug use, suicidality, other risky behaviors, right? We want to help parents learn how to keep their children close to them, not push them away. So again, it's not really a straightforward answer, because there is no really good formula, right, for how to address these things other than understanding perspective, exploring how to do it in a safe and healthy way. Chris wanted to know in the chat if there is a list of professional counselors who provide services on this subject. There is not. PFLAG, which is an amazing organization, it used to stand for Parents and Friends of Lesbians and Gays, but PFLAG has done away with the acronym and is now just PFLAG. Um, um, there is a chapter of PFLAG in Norman that has existed for decades. There's a chapter in Oklahoma City that seems historically has been a little bit more transient. Sometimes the chapter is active, sometimes it dissolves and reforms years later. But often reaching out to PFLAG, the one in Norman tried for the longest time to have a list of providers who work with LGBTQ plus youth. And it's just hard to keep up with that. In the magazine Psychology Today, therapists have their own advertisements. Many of them say that they work with LGBTQ plus youth. They may be inclusive in who they accept as clients. They may have training specific to working with SOGI youth or people. So there is no list, but I would recommend reaching out to organizations like PFLAG. There's also, I think it's called the Equality Center in Tulsa. There are LGBTQ organizations that you can reach out to and ask for any information they may have on providers. I will say that at one point I was working toward providing or starting a program for children who were LGBTQ plus or SOGI, so not adolescents. And I found no one in Oklahoma that was working specifically with children. There's a therapist in the metropolitan area, a psychologist, Heidi Kam, that generally works with trans adolescents. And I think it tends to be older adolescents. The field is changing though, and I think more and more people will start to work with younger children.
Jimmy,
So,
I have a question.
yeah.
This is Brenda Bucci in Tulsa. I work with a huge population of women that are at a residence for recovery, and they're there with their children. I would say probably 99% of those women were sexually abused as children. Is there any study looking at, and then they have become, or they have changed their preference for sexual partners to the same sex? And I just wondered if there's any research on that.
That's a good question. So there is research on how does sexual orientation develop. Are we born gay? Are we born with our sexual orientation? Or does our environment influence our sexual orientation? And so if we just start with that, and it's a very controversial subject because it has huge implications, right?
Sure.
And your name is Brenda, correct?
Right.
Oh, thank you,
Right.
Brenda. So Brenda, what we know from the research, I promise I'll get to your question, is that the general consensus is sexual orientation is a mix of nature and nurture. So there's some research to suggest that the structure of brains in people who identify as homosexual is slightly different than heterosexual counterparts, but there are studies too that find that environment, right? So I'll disclose a little bit about me. I grew up with a domineering mother. My father worked all the time. So already Sigmund Freud is like, foaming at the mouth, because that was one of Dr. Freud's kind of positions of homosexual men really were more strongly influenced by their mothers, who were domineering and absent fathers. I was also sexually abused by a pedophile when I was a young boy. That was very confusing to me. And in my adolescence, I wondered, am I having these feelings because I don't have a male role model in my life, or a very strong one? Because this man gave me a lot of misinformation as part of his grooming to fondle me as a young child. It was a very confusing time. And who knows what ultimately, right, has contributed to my identity as a homosexual, right? And so there is a myth that if you've been sexually abused or experienced trauma, that's going to have a bigger influence on your sexual orientation. but that's all it is. It's a myth. And so we don't really know, Brenda, if how we don't know the impact of trauma can have on that. We do know from research that um, uh, bisexuality or homosexuality in females is much more accepted around the world than homosexuality in men. Interestingly, the country of Singapore, male homosexuality, completely illegal. Female homosexuality, not illegal at all, right? And so I think when people are aggregated in a residential setting, and I don't think there's any research on this, but kind of what I've seen is that it's not uncommon for people to form relationships and that then have a sexual component potentially. There's a term used in female prisons. It's probably dated now, and I'm trying to remember the comedian who did a documentary, maybe Kathy Griffin, which I've lost all respect for, but that's a whole other issue. LURD, lesbian until release date. And that was a concept we saw in the Netflix series Orange is the New Black. Female inmates who were heterosexual, but long-term incarceration with other females engaged in homosexual sex as a way to meet their needs. And so people make decisions for lots of different reasons. It may be that these women that you, in your question, have an emotional attachment, and that's contributed to their behavior. So it's really hard to know, but there's no research that indicates clearly one way or another what could be
Okay.
driving that.
Well, thank you, Jimmy.
It's probably the downside of talking about SOGI people is that there isn't a lot of clear research moving forward, other than knowing that being an ally, engaging in affirmative practices is what helps people be healthy and happy. So there's another question in the chat box from Stephanie. Any behavioral health counselor who help families can address a family's discomfort with a child's identity or expression. It isn't a specialty in counseling. I'd say yes and no to that, Stephanie. There are some people that work only with specific populations, and they would consider that a specialty. In Oklahoma, if you're a licensed behavioral health practitioner or a licensed mental health practitioner, LMHP, if you want a specialty license, that has to be approved by the board typically, and my understanding is they don't do that often. But some people say they specialize in working with LGBTQ plus people. North Care, which is a community mental health organization in Oklahoma, primarily the metro area, and Red Rock Behavioral Health Services, also primarily in the metro area, but they have satellite offices all over the state. They have specific programming for LGBTQ plus youth. And I'd say the providers I know that have been in those programs would say that that's their area of expertise. They may not say specialty. Much like there are Christian counselors who say they specialize in Christian counseling. But ultimately, I think, Stephanie, where I think what I said earlier is that we all have the skills and education and training to address when a parent has a strong reaction about their child's behavior, whatever that may be. And in some ways, again, in another kind of grossly simplistic way, I remember as a child, my parents just didn't understand why young people in the 80s would have a mohawk. My mother certainly didn't understand, my father either, when I got my ear pierced. And there was a lot of disagreement. And like I said, that's a grossly simple kind of comparison. But when families don't understand their children, particularly now since children are expressing themselves more aptly, we have the skills to help mitigate that discord or incongruence there. So I'm seeing that Kim also has something in the chat box. Kim says, I'm a bit confused by a situation a colleague was presented with. A man came in for services with his toddler daughter. His appearance in every way was male, and he is married to a man. Colleague referred to him as dad, and he said the child wouldn't know who she meant because child refers to him as mom. colleague was fine with the correction, but confused because she hadn't been presented with this information before. Is this common? Uh, I don't know if it's common or not. Parents select their terms on their own. I don't know if I've ever heard of a same-sex couple um, still using mom and dad to refer to the two same-sex parents. I hear daddy and papa from my same-sex male friends and couples with children. Um, uh, and so I don't know. I think what your colleague did was follow the lead of the parent. And so who knows, maybe the two dads were working with their child on just trying to understand language. Remember, children are inundated with a binary construct from everywhere else because people who are SOGI are in the minority. When you go to the store, we see binary everywhere. When children are in daycare, it's natural for kids to say they have a mom and dad. Well, what about you? Well, I think I have two dads. No, you've got to have a mom or dad, right? Because kids are learning and trying to make sense of things. So the professional should follow the lead of, right, the person that is directing that lead. So if this dad right now, my child calls me mom or mommy, okay, if anything, it could just be asking for, just kind of, I'm confused. Can you just help me understand? I just want to make sure that I'm providing the best service to you that I can, and maybe a little, maybe you sharing a little bit more with me. So I make sure that I'm on track with you. Always trying to be the ally, right? And aligning with someone. Just as if someone tells you, I'll use another example. I met someone who was a trans man a couple of years ago, and we knew someone in common. He was really very excited, and a couple of times I misgendered this person and referred to him as she or her, and he was really very kind about it. He's like, honey, you just misgendered me again. I am very sorry. Thank you. Even if I think of times where I've met people who still have a very masculine presentation, but identify as female, and they want to be called she, her, and hers. I'm going to follow that lead, and that can be challenging if you struggle with understanding why someone would want that. But following their lead is part of providing affirmative services. Lori has in the chat box, some parents may inadvertently give cues. The child may perceive the parent as pleased when they do or be a certain way. Absolutely. And this gets back to how we learn. Just go back to basic, your basic graduate education or college education on learning theory. We learn from those around us, the environment around us. And so, that's where we get the majority, right? A majority of children, boys identify as boys and they do boy things, right? Because that's what the environment around them is like. If you're having a baby and the doctor tells you it's a boy and you deck out your nursery in all blue and sports and dump trucks and boy things, those are the messages that your child's going to get. And so, again, it's something that is confusing to a lot of people, but there are some parents who are gender neutral with their child. They let their child pick their own pronouns, even as young children. They choose all gender neutral colors and activities, or they provide their children with both stereotypical boy and girl options and let them choose whatever they want. Again, moving forward, how do we help children be healthy and happy? If you let a boy dress as a girl when he's young, remember, that doesn't predict who he's going to be when he grows up. My grandmother, God love her, and my mother both, when I came out to them, my mother said, I used to dress you up as a girl for Halloween. is that what happened? No, nothing happened, right? That was a costume. And I understood that was a costume. It was a damn good costume too. My grandmother, whom I came out to later, shared that she knew two women when she worked at a bowling alley in Virginia, way back when, who both dressed like men. Um, and she said, is that why you are who you are? No, it's not. Um, people think that all drag queens are gay men. Well, that's false. There are a number of drag queens and female impersonators who are heterosexual. There are a number of drag queens who are actually female now. That's become really popular. So if we can provide, again, an accepting, healthy environment for children, they'll develop on their own just the way that they should. So keep that in mind. Let's see, also from Chris, how should we address the question on our screening and evaluation tools? Excellent question. Screening tools, asking the child, are you a boy or a girl? For credit, the child needs to answer correctly. All right, so this is where I'm gonna blow your mind. What does correctly mean here? I understand that psychological measures, instruments, surveys, and tools need to be scored. And often, if you are looking at normed measures, then you're looking at gender normed measures, right? You're looking up a raw score on boys ages 3 to 5, 6 to 9, 10 to 12, and girls in the same age ranges. Here's what's recommended by the American Psychological Association. You have some control over how to score that item. And this is where people might disagree or where your minds are blown. Ultimately, if you ask that question and the child gives an inaccurate answer, you're left to make some assumptions in the moment, right? Hopefully you've had some conversations with the parent beforehand on some basic demographics. And so hopefully you've got a heads up that this child is gender fluid or potentially trans or is questioning, right, who they are. And then, how we want to score accurately but ethically and helpfully. And so I would recommend in this kind of situation that it would be one ideal that as you're getting demographic information, that you have space on your forms when you ask for sex or gender, that it's male, female, other. And that for other, you leave a blank where someone could write it in. And if you have concerns that you think, you don't want to be caught off guard, asking parents beforehand, you want to make sure that you're being sensitive and, you're just developmentally appropriate. And you notice on the form that they marked male for their child, and you just want to check in. Does your child identify as male, or is that how you identify your child? Ultimately, if the child is assigned male at birth, but in the assessment says female, and you have information to suggest that this child really does identify as female, then I would score it as correct. Remember, it's going off of, does the child have an accurate understanding of who they are? And the child knows that better than we do. Most psychological measures, screening tools, evaluations, instruments, etc., are heteronormative. They are built on this construct of binary male and female. And so you as the professional, you as the assessor, you make the decision, right, on how to score that item. I would probably err on the side of scoring it correct. And then, at the end, as I'm scoring the tool, and I'm looking at what does this mean, right, my interpretation, and I'm taking that into account as well. We as professionals should not be just saying, no, that was a T-score of 110, which is 1.5 standard deviations above normal, and therefore, significant. Well, again, we're professionals. We should be taking everything into account to make our decisions. So you know, consult with a colleague, help people, you know, talk through it, figure out really what makes sense. It's going to be a long time, I'm telling you, a long time, and not in our lifetime, that measures are going to offer something other than a binary when it comes to male, female, or gender. Um, Even if you do a review of the literature now, I mean, it's just not out there. But the general guiding practice is that we make that decision, and um, we not consider it a wrong answer, but take it into the full context. Also from Lori, in Circle of Security Parenting, we talk about how by the time children are 11 months old, they've learned to anticipate and avoid things that make the parent uncomfortable. Absolutely true. And where we see this in gender expression, sexual identity, um, children avoid uh, punishment, right? They avoid things that they don't like and they do things that they do like. That's why children like to run around naked. They don't like the feeling of scratchy clothes on their skin or the constriction, right? They just want to be comfortable. It's not because they want to be naked. They just want to be comfortable, right? And so they're picking up the cues of their parents all through this. And so if the parents are giving cues or direct feedback that they're displeased with something, or they provide discipline, children are going to react, right? And they're going to want to please their parents. That's just how we learn behavior. And so for children, ultimately, for example, that have a disruptive behavior disorder, um, that need parent-child interaction therapy, right? We're helping to correct their behavior through effective discipline, but also through investment in their relationship with their caregiver. When it comes to parents who are trying to shape their children's sexual identity, gender expression, or sexual orientation, we know that those things can be shaped, but parents should also be mindful when it might be causing distress to a child and use that to gauge when to make changes in their parenting practices. I'd say that, you know, when I was a child, I got lots of cues that, you know, people thought I was cute. I mean, look at me, I'm a Greek god by all definition, right? But it was cute and, oh, he's just a little womanizer. I thought that's what I had to do. And sometimes I've wondered if in my adolescence when I was confused, if that confusion was impacted, right, by all of the cues that I got as a child that boys like girls, right, or men like women, guys like girls, etc. And so um, when my mother started to notice that I was in distress in adolescence, when I was experiencing bouts of depression, um, you know, that might have been a time to have a conversation and to try to understand and move forward. So again, it's getting parents back to, if they love their child, that's the goal, healthy and happy. Now, it's important, you know, I keep saying healthy and happy, right, is the goal, but parents come with a lot of dreams and hopes for their children. Think about children who are adopted, um, right? When you adopt a child, you have, or when you're pregnant with a child, or your partner is pregnant with a child, you immediately have dreams, you immediately have hopes. You want your child to grow up and be a doctor. You want your child to be neurotypical, right? You want your child to be, you know, you can't wait for them and their wedding and grandchildren and all of these things, right? You want your child to grow up and be an outstanding member of the church. My parents got none of that. My parents wanted my sister to grow up to be a mother, married, um, grandchildren. And my sister grew up, got married to a man who's black, and my family is white. My parents were not okay with that. Then they were like, well, holy cow, wait a minute. We don't want you to have children now. We wanted you to have children. That was part of our dreams for you. But now you're going to have children who are mixed race, and no one will accept them. Then my sister had kids. And the second my sister had children, she had twins her first pregnancy, my parents melted and their assumptions and their dreams changed. when I came bouncing out of the closet at 17, right, I was not at all what my parents wanted as part of their dreams and their hopes. I'm also not Christian. That was a big deal for my parents. I tend to be much more liberal than my parents. And so when you're working with families that are really struggling with their child's identity, expression, etc., it's often because they're scared, because they're having difficulty reconciling their dreams with the reality of who their child is. I once dated someone who was adopted. It was my first long-term relationship. Did not know he was adopted. He found out by accident. His parents were very upset when he came out to them. And ultimately, what we learned was when his parents adopted him, they thought they were adopting a quote unquote normal child who was going to grow up, a wife, 2.5 children, right, successful career. And now suddenly their dreams were not going to manifest the way they wanted. My mother was in a similar position when I came out to her. She had read a journal of mine where I shared that I'd gone to a local um, uh, club for young people. It was called the Rec Room in Oklahoma City. It's no longer around. And sometimes I like to look at girls and sometimes I like to look at boys. And then my mother, I didn't know she read it. She started acting funny. At the same time, my mother was friends with two men who were in a relationship, one of which was HIV positive. Um, and so my mother is trying to make sense of it all and said some really hateful and hurtful things to me. And as our relationship developed and we got beyond that, I learned that my mother was just terrified that someone was going to hurt me, because that's what she had learned from her friends, that they had been the victims of homophobia and had been physically hurt. She was scared I was going to catch HIV and die of AIDS, and she didn't understand the disease and any part of it. And so she was operating out of a place of fear, and I think that's where most people operate from. When right, there are these issues, they're scared for the safety of their child. They scare. I'm sorry. They're afraid, right, for the safety of their child. They're afraid what this could mean for their family or how people will treat them as adults. So it's difficult, and it makes it a little bit more challenging when we're trying to help a family manage through dynamics that could be hurtful and harmful to the children or other people. So we are right at 11:55, and I want to stop talking and pass to Chris just for a quick second. I see you're back on video. Oh, and Chris, you're muted.
There, sorry.
There you are.
Definitely don't want to cut anybody off if you have another question, but we are coming up on 12. And so, Jimmy, thank you so much. I think this is just so interesting, and I need more knowledge because knowledge is power, and I want to be able to help the families that come in to see me in my clinic. And I just appreciate you speaking so openly with us and educating us on this subject. So thank you for that.
I appreciate the opportunity. And I encourage you all, like I did in part one, if you were able to attend, just take some time, learn more about SOGI youth and people. There are a number of great shows, documentaries available through Netflix, Amazon Prime. I mean, there are a number of reputable websites that you can go to. And so just learn more, keep an open mind. You don't have to agree with anything, and you don't necessarily have to support anything. But what you are required to do as a professional, remember, is to help people be healthy and happy. And so I will share these slides. You know, I don't know really what all there is to share, since most are pictures of trans and non-binary youth. But I'll include some of the resources that I did in the last presentation, so that goes out to you. I am available if you have other questions, if you are looking for direction. I hope you will reach out to me. You can reach me by email or phone, that's on the screen. I'll just really quickly, I want to respond to Kim. She had an item in the chat box around a parent who was very upset at a daycare where the director let a child, a boy, dress in girls' clothes, insisted it not be allowed to happen. Kim, I think you know, get online. There are a number of great organizations that offer psychoeducation materials around sexual development and gender development in children, and how it means nothing other than a child is exploring. I think most boys are just innately fascinated by how girls dress because it's so different. And it means nothing more about them. It's just different. And so I hope that you'll be able to find some things. Contact me if I can be of help in locating some of those resources. So yeah, thank you all very much. I hope I didn't over disclose or go on too many soapboxes. That's a horrible habit of mine. But clearly something I'm passionate about. And I'd much rather live in a world where we can respect and benefit from diversity, and not be scared of it. So thank you all very much.
Thank you, Jimmy. We really appreciate your time towards this. And just a reminder to everybody, I will be sending out certificates, and then I will be submitting all of your names to central office as well, so you can get CEUs for this. Thank you. You guys have a great weekend. Have a great long weekend and be safe.
Goodbye, everyone.
Bye-bye. Bye, Jimmy. Thank you.